Hey guys, this is Haley, and in today's video, I'm going to be talking all about my PICC. If you aren't already, I would follow my Instagram account, Haley's Life Through a Lens, as I update a lot more frequently on my Instagram, and I've talked a lot about my PICC there. So go ahead and follow me. My handle will be in the description. So starting off, the first question you guys probably have is, what is a PICC? If you guys aren't familiar with central lines, you probably haven't really heard of a PICC as they're not super common. So PICC stands for peripherally inserted central catheter. It is a long, thin tube that is inserted into a vein in your arm, and then it is passed through the larger veins near your heart. It's a type of central line used for patients who require frequent IV use. It helps avoid frequent sticks or developing a ton of scar tissue, or it's for patients who already have a ton of scar tissue and they need a PICC so that they're able to still infuse or give treatment or whatever. So the next question you guys are probably wondering is, why did I get a PICC? So I got a PICC for my condition known as POTS, postural orthostatic tachycardia syndrome. If you guys are interested in learning more about POTS, link in the iCard. I did a whole video about what POTS is. So about a month or two ago, my doctors and I decided that I would most likely probably need a central line due to needing frequent IVs to manage my POTS symptoms. If you guys want a whole video on like how IV fluids helps POTS, I could go ahead and do that. But I also made a post over on my Instagram, probably several posts, talking about how saline infusions have helped my POTS. But if you guys want a whole video on that, I will go ahead and do that. So my doctors and I, about 1 or 2 months ago, decided that I would most likely need a central line in the future because of how often I was needing IV fluids to manage my POTS symptoms. We didn't really expect that I would need a central line so soon, but for various reasons, it just kind of happened earlier than we anticipated, just for various reasons that I will touch on in just a little bit. So I know I haven't talked a lot about IV fluids here on my YouTube channel, but I've actually been receiving IV fluids twice a week since around November. So I have been receiving IV fluids for several months now, and they have literally changed my life. So I've been able to just do housework again. I've been able to work like for my YouTube channel. I've been able to do so much more things that I just wasn't able to do before because of my POTS, either because I was blacking out too much or my fatigue was way too high. Honestly, the amount of relief I've gotten from IV fluids is incredible. So the next question might be, why did we decide to get a central line so soon? So there were two main reasons that kind of made the choice of getting a central line kind of come sooner than we expected. The first thing was kind of financially. So our insurance kind of is a little bit different than it used to be. It changed last year to going to co-pays. So basically, we don't have to pay a percentage, we just pay co-pays. But it's kind of frustrating because anytime you're like going to the hospital versus like a doctor visit, it's an automatic $250 copay. So because my IV infusions were at the hospital, every time I went to get an infusion, it was $250. So because I was going twice a week, that was about $500 a week. And that is a lot of money for just 1 liter of saline. And it's quite ridiculous in my opinion. I don't know why it was so high, but that's just kind of how our insurance was, and there was nothing really we could do about it until we hit our deductible. After a couple weeks, we definitely hit our deductible, but our insurance is about to reset again. It resets in April, I believe, March or April. So we would have to go through that whole process of like spending all of that money again just to get IV infusions, and that was just a lot of money for a treatment. Personally, like, that's $1,000 every 2 weeks. Like, that's a lot of money. And just to put it into perspective, a bag of saline is like 10 to 20 bucks. Like, it's not that expensive. So we were just paying a ridiculous amount because technically I was being seen at the hospital. So it was just kind of frustrating. So that was the main reason. We figured out that if we went to home health, it was only a $50 copay. And I believe that's only $50 when a nurse comes to my home. I don't believe it's $50 every treatment, but I have to look into that still. So either way, it is way like $200 cheaper to do it from home than it is to go to the hospital. So that was one of the main reasons, was financially. We just weren't able to keep going to the hospital for IV infusions. The second reason is the closest hospital I was comfortable going to was about 40 minutes away. We don't have a major hospital in my town. Basically, that meant I was driving 40 minutes there, and then the infusion lasted about 2.5 to 3 hours, and then I had to drive 40 minutes home. So that was like a 5 to 6 hour thing that I was doing in one day, and that's a lot for me to do. It's a lot for me to be gone outside of the house. I get very tired. I don't do well with driving long distances. It was just literally, I was so exhausted by the time I got home. And I just felt like after spending that much energy out at the hospital for like 6 hours, that by the time I got home, I was so exhausted, and I felt like I would get more benefit out of IV fluids if I was at home and able to do it, you know, when I wasn't like out of the house all the time. So those were kind of like the two main reasons, and I brought those up to my doctor and we discussed them, and that's why we decided to get a central line so soon. A lot of people are wondering what the difference between an IV and a PICC line is. So an IV is basically just a needle that goes into the vein in your arm, and it can stay there up to 3 to 4 days at max before it needs to come out, due to like there's a lot of risks for keeping IVs in that long. So they're not a long-term thing, as the insertion is not very big. Like, it's just a small tube going into your vein. They don't last long, 3 to 4 days at max. But a PICC line, because it's a long tube that is inserted into the vein all the way up into a larger vein near your heart, it is able to stay in your body for up to 6 to 12 months. It just depends on the person and how long you need treatment, but it's a much longer term thing than like an IV would. So that's basically the difference between PICCs and IVs. Oh, also a PICC is considered a central line because it's near your heart, and there's a lot more risks associated with central lines versus IVs. So there's a lot more risk of sepsis and blood clots with PICCs than there is with like a peripheral IV. The next question everyone's asking me is, how long will I have my PICC for? So I do not know for sure, but when I went into the hospital to get my PICC placed, the orders said that I would have a PICC for 6 weeks, and then it would be switched out for a port. Now, my doctor never officially told me that. It was just in my orders, so I don't know for sure if it will be 6 weeks, longer or shorter. I just kind of have to communicate with my doctor and figure it all out, but my guess is around 1 to 2 months. The next question I'm getting a ton is, why did we decide to get a PICC versus a port? I am not 100% sure exactly why my doctors chose a PICC versus a port, but these are kind of like my ideas on why they did it. So I think the main reasons they did it is a PICC is a really, really easy procedure, something that can be done like real fast. And because I was wanting to do home health right away, they thought a PICC line would just be easy to do so that I'm able to start home health. A PICC line is also not as major of a commitment. It literally can just be pulled out in an office. It's just a tube going up through your vein. So all I do is pull it out and you don't have a central line anymore. Whereas a port is like a surgically implanted device in your chest, and it lasts like, I think I've heard like 3 to 5 years. It's a long-term commitment, so my doctors didn't want to jump to a port if after I started home health I realized this wasn't necessarily a treatment I wanted to continue. That's my guess. However, I believe that I probably will be doing home IVs for a long-term treatment, so most likely we will end up switching to a port, but they just wanted to be really cautious because they don't want to place a device in me if it's something that like 2 weeks from now I'm like, oh, never mind, I don't want to do this anymore, or like we started IVs and we realized it's not giving me enough relief or whatever. So I think it's just kind of a cautious step that they were taking. And the other reason that I don't think they jumped to a port is that my dysautonomia clinic that I go to is fairly new. I believe it's like 3 years old maybe. So they've only been treating POTS patients like relatively newly. and they've never placed ports in a POTS patient before that I know of. So they're still researching it. They're still figuring out like the logistics on how it works, like with insurance and all of that. So I think because I wanted to start this so soon, they weren't ready to prescribe a port, but I think within a month or two they will be ready. So I don't know. I think that's the main thing. Honestly, like I'm just doing what my doctors are recommending to me, so that's why I got a PICC. Does getting a PICC line hurt? So I've been asked this quite a few times, and honestly, it doesn't really hurt. Like, it's not something that you're literally like crying or like screaming in pain. Like, it's not even on that level. It's not even that painful at all. The only thing that's kind of painful is they insert, I think it's like a needle. I don't know, I couldn't see because it's a sterile procedure. They had me draped. And so there was like a blue like thing over my head kind of, so like I couldn't see what they were doing, but I believe they inserted like a normal IV, and they put lidocaine through my vein so that it would numb the vein so that I wouldn't feel the tube going through. So that part, like, it wasn't like painful necessarily, but it like burned. I believe it's the same stuff they use for like cavities in your mouth, so it's kind of like the same thing. So that part was like a little uncomfortable. And then after it was numb, they waited until it was numb. Then they started putting the tube in. The issue with me is that they were having trouble pushing it in. I don't know exactly why. They said my skin was like, I don't know. I think it's because I'm like skinnier or something. I don't really know, but they were having issues like pushing it in. And even though you're numb, so it doesn't hurt, I could still feel the tube going up into me. And I was very anxious. I have anxiety disorders. I have panic disorder. So I started to get really anxious when I felt the feeling of the tube going through me, and I started to pass out. So the nurse had to run and like give me ice chips to like help me not pass out. But other than that, like, it didn't hurt. It just really freaked me out. And if I was to do it again, I would ask for, you know, like a Xanax or an Ativan or something just to calm me down. And honestly, I don't think normal people would need it. It's just I do have a history with high anxiety and high potential of having panic attacks. So I was just like, I was so nervous that I think I just started to pass out. But other than that, it was fine. Like, it wasn't really that painful. After it was done, I was sore, I would say, for like about a day. Maybe a day and a half or something, but other than that, I wasn't really that sore. I am very bruised around where they inserted the tube. I can show you guys that later. I'll put a disclaimer first, but I am very bruised around where they inserted the PICC. So if I touch it or if I bump it, it is sore, but it's just like any other bruise. It's not like super painful. So honestly, it's not really that painful. It just scared me a lot. So yeah. Some people were wondering on how having a PICC is gonna change like my everyday life. Like, what are some things I can't do because I have a PICC? There's literally two things that come to the top of my head. The first thing is I can't lift, which this is the thing that is really bothering me and why I really want to get a port sooner rather than later, is I can't lift anything over 10 pounds. Otherwise, you risk getting a blood clot in your line, which can be dangerous, and also like you'd have to go to like the emergency room and try to get it removed, or they'd have to pull your PICC out. So because of that, I'm not allowed to like lift my rabbit's hay, my rabbit hay boxes, my rabbit's litter boxes. If anything is over 10 pounds, I shouldn't be lifting it. So that's like the major thing. Also, I cannot lift my wheelchair out of the car because my wheelchair is heavier than 10 pounds. So yeah, I've heard some people say once the PICC line heals, after about 2 weeks, they break the rule and they do lift things. However, I just don't want to risk it. I do not live close to a hospital. I am not going to be like risking anything if I can help it. So yeah, that's one of the main things. So I can't go grocery shopping unless someone is with me because I need a wheelchair when I grocery shop. I'm just not able to walk that far yet. So that's honestly, the biggest thing that is annoying is I can't use my wheelchair. So the second thing that I can't really do with a PICC line is you can't go swimming or submerge your arm underwater. So I don't really like to swim, so that's not a huge deal. Also, middle of winter, not really gonna be swimming. You could probably take a bath if you covered it and kept your arm out of the water and you were really careful. But you can shower if you cover it. I covered it twice with like 2 different things just because I was like super cautious, and you can't shower more than 20 minutes. Otherwise, there is the potential of your bandage or whatever like steaming up on the inside. I don't know how common that is, but I have heard if you're like in the shower more than 20 minutes, it could do that. So yeah, other than that, there really isn't anything that changes my everyday life. Another question was, what maintenance is required with a PICC? There isn't a whole ton that I necessarily have to do. Once a week, a home health nurse comes and changes my dressing. And that is a very sterile procedure. So because it's a central line and it goes directly to your heart, everything is very sterile. So that's something I have to do once a week. Other than that, I do have to flush my line and with saline, and then flush it with heparin once a day. So now I thought I'd go ahead and show you my PICC. If anyone doesn't want to see this, you can stop watching. But yeah, you don't see any needles or anything like that. This doesn't even have any needles, it's just a tube. But anyways, just thought I would warn you. So I do want to mention I have this PICC cover right now. It's from the brand Mighty Well. I'm actually an ambassador for them over on Instagram. And so when I got my PICC line, I knew I really wanted one of their PICC line covers. They are literally the best PICC line cover I've ever seen. So you want to always keep your PICC line covered just so that you have like tubing connected to it, and if it's not covered, there's a risk of it getting caught on something or pulling out, and your PICC line can easily be pulled out, so you have to be careful. And you also want to like keep it clean and stuff. But the Mighty Well PICC covers, they just come down like this, so they actually fold over itself. So right here is all my tubing, if you guys can see that. So I just undo my tubing. I basically just wrap it around my arm. So there we go. And then this is where it's inserted into my arm. But now I'm going to take the PICC cover off, and it has these little holes for the tubing to come out of, which is super cool. So you just kind of have to be careful when you're taking the line out that you're not pulling. And then the cover just comes off like this. This is a look at the PICC line. I don't know how well you guys can see it from this angle, but basically there is this dressing over the top. I'm using Sorbaview, but I think I'm allergic to it because I'm allergic to all adhesives. And then I have a bio patch, which is basically like antibiotics in this little foamy sticker. It just helps with decrease infection. And then the PICC line itself is this purple thing, and it's connected to the purple tube that well, actually I don't know if the whole tube is purple, but on the outside it's purple and then it goes up. And then this is the end of the PICC line, and then this tubing right here is extension tubing. And this is where I basically flush the line, hook up to IV fluids, all of that. But yeah, that's basically it. I can go into more detail if you guys are curious, but again, I'm very, very new to PICC lines, so I don't know everything. I literally got my PICC line like on Wednesday last week, which was not even a week ago. So yeah, I just thought I'd show you that. So now I'm gonna go ahead and put my PICC line cover back on. Anyways, yeah, that's PICC line cover. So there's a lot of different covers out there. This is just the one I really like. I will leave the code on the screen for you guys to get 10% off your order if you guys are looking for a PICC line cover, and then I'll also leave it down in the description and a link to the company if you guys are curious. So they're not sponsoring me or anything. They literally, I just really love their product. So that's basically it for this video on all about PICC lines with pots, although I didn't really talk a lot about pots in this video. But if you guys have any further questions, please leave them in the comment section down below. I'll do my best to answer them if I can. I'm also hoping to do a couple more videos with my PICC line, hopefully soon, just because I don't know how long I'm gonna be having the PICC line. But I thought a couple of videos you guys might be interested is like a day in the life with a PICC line, how I do my saline infusions with a PICC line, and like all of my supplies PICC line video. So like all the supplies that I have for my PICC line. So let me know if you guys would be interested in any of those videos, or if you guys have any additional videos that you think would be cool to see, leave them down in the comments below. So that's basically it for today's video. I hope you guys enjoyed. Don't forget to comment, like, and subscribe if you want to see more videos about pots or PICC lines or anything like that. Also, don't forget to follow me on my Instagram at Haley's Life Through a Lens, as I post a lot more on Instagram than I do my YouTube channel, and you can keep more up to date on what's going on with me or whatever, so go ahead and follow me there. So I'll see you guys very soon on a new video. Bye! Can you not do that in the background? Because of